Welcome, everybody. I will just make a brief couple of remarks to introduce today's speaker. For everyone who's on here, many of you know, but somebody I have not met. My name is Andrew Butler. I'm the Dean of the School of Health Professions. Welcome, everyone, to the school's Community Month webinar. I'm delighted you could join us today. Community Month is hosted by the university's Office of Diversity, Equity, and Inclusion each January. It's a month-long celebration of UAB's commitment to diversity, equity, and inclusion through a variety of activities. Community Month engages students, faculty, staff, and the broader community in UAB-centric diversity initiatives. Many of these events allow departments and organizations to showcase their diversity efforts through presentations, performances, and lectures like this. Others will allow participants to take part in critical dialogues and collaboration with local community partners. I'm excited today to introduce today's speaker, Gina Calder, who will be sharing her experiences on inclusive leadership. In February 2021, she became the first Black female president in BJC HealthCare history when she was named to lead Barnes Jewish St. Peter's Hospital and Progress West Hospital. Prior to joining BJC, she held various executive roles with Yale New Haven Health, including vice president. Ms. Calder has received many honors at the local and national level, including being named a champion for diversity and inclusion by the St. Louis Business Journal, receiving the Distinguished Service Award from the American College of Healthcare Executives, and earning a place on Becker's Hospital's 75 Black Healthcare Leaders to Know. Today, she's going to talk to us about transforming our leadership approach to be more inclusive. This will engage our most critical resources, our people, and it will ensure that our organizations thrive in a fast-moving, ever-changing world. Please give a warm welcome of clapping emojis to Gina Calder. Take it away, Gina.
Thank you, Dr. Butler, and good afternoon, everyone. I'm really grateful for the opportunity to be here with you today. I'm actually at a conference of the Equity Collaborative in Los Angeles, so it is morning here, while it is afternoon for you all, and just really glad to be talking about something that is near and dear to my heart. And quite honestly, I think one of the areas that I and all of us have the opportunity to make great impact in, both in terms of our own leadership, but also in terms of all those that we get the opportunity to touch in the healthcare space. So why are we here today? And Dr. Butler spoke a little bit to this. We want to together explore ways that we can transform our leadership so we can become more inclusive. We want to do that in a way that really engages our people in an enhanced and more intentional way, so that we can provide better care for our patients and overall increase the health of our communities. And then, given all that we have encountered and endured over the last several years, we know that we have a critical imperative as well to ensure that our organizations thrive. And again, inclusive leadership sets us up for success in all of these arenas. So just some of the things that we'll cover today, and I won't go through all of this, you all can see the slide, but really just wanted to talk a little bit about why this is such an important topic for me and really a driving part of my own career. As Dr. Butler shared with you all, I serve currently as the president of the St. Charles County Hospitals for BJC HealthCare. We're a large regional academic health system that serves the states of Illinois and Missouri, and I will be coming up on my second anniversary in this role and serving with this great organization next month. And the reason really that I made the 1,100-mile jump from the East Coast to the Midwest was because of the wonderful aspiration and vision that we have at BJC HealthCare to drive equity for the communities that we are privileged to serve. And I have had the wonderful, I think, growth opportunity of being in spaces and places where equity was not always at the forefront, not only in terms of the care that organizations that I was connected to were providing, but also internally in terms of how we leveraged our talent and just the wonderful resource that we find in our people. So I can remember one particular situation where I was taking the lead on a huge greenfield construction project and walked into the very first meeting that I was leading and essentially was kind of boxed out of my own meeting. I was the only woman, the only person of color in the room, and other members of the team that I was going to need to lead basically showed me that they were not necessarily interested in my perspective and my leadership by ensuring that there was not a seat at the table for me. And so, many people often find themselves in those situations and positions and, kind of what do I do in that situation? Well, I found a chair in another room and I kind of, made a comment about creating some space for me and kind of scooted myself right into the head of the table. I think much to the chagrin of some of those who were at that table, but I think it also just demonstrated to my soon to become team that I was not going to be easily intimidated and that, there were bigger things on our plates to have to handle and that we needed to be able to do that together. That we had to value the expertise and the perspective of everyone in that room. We had to reevaluate who was in that room and who maybe was not in that room that needed to be so that we could be successful in that endeavor. And fast forward about 18 months, we were able to open that $120 million greenfield construction project on time and under budget. So some working definitions that I want to take you through so that we all know that we're on the same page in terms of what we're talking about and the kind of terminology that we'll be using in this space. Many have heard these terms. Diversity, really it's a representation of varied identities and differences. Equity really speaks to the fair treatment and equality of opportunity and access to resources for people. Inclusion really is an active invitation to all to participate and contribute. And then, we want to be able to create that sustained culture of belonging. So if we think about it in terms of a party, diversity really is making sure that, invitations are kind of going out to any and everyone that you can imagine to invite. Equity is the opportunity for folks to be able to be a part of and engaged in determining, how that party is going to go and making sure that everyone has that opportunity, right, to weigh in. Inclusion is making sure that as folks are there at the party, that anything that would be interesting to them in terms of how they want to interact. If they want to be on the dance floor, great. If not, that's great too. Then that's a wonderful thing. And then belonging is knowing that no matter what choice you made, right, whether you decided you were going to dance all night or whether you were going to be a wallflower all night, that there's no judgment, right, that's being offered to your decision, but that you're being embraced regardless of kind of how you decided that you were going to enjoy yourself in that setting. Some other definitions: overrepresented. So this is really when we start to talk about data, right? When we're looking at population stats, overrepresented means that you have a greater representation than your population statistics would predict. And then on the other side, underrepresented, that you have a lower representation than your population statistics would predict. So let's talk a little bit about healthcare. Since we're in good company with many of our healthcare leaders and aspiring leaders today. True or false? Healthcare has a high level of diversity. True or false? Actually, I don't have access to the chat. I wish I did, because then I could have folks kind of put their answers into the chat. But this is true. So our industry is an extraordinarily diverse industry. And as reported by the U.S. Department of Labor, when you kind of look into the statistics, you see all kinds of gender, racial, ethnic, and other diversity because there's so many different fields, right? There's so many different disciplines and specialties and, levels of training and experience that we get to bring together in the healthcare space. So we start out in general as a very diverse field. Second question, women constitute what percentage of the healthcare workforce? 30%, 50%, or 75%? Women constitute what percentage of the healthcare workforce? Many of you probably got this correct. When we're talking about healthcare provider organizations, so those of us who deliver care, women actually make up over 75%. And across healthcare, if we begin to incorporate, our payers and other entities, it's about 66%. But clearly, the vast majority of the workforce in the healthcare space is made up by women. And much of this is really due to nursing continuing to be a very large proportion of our team and still predominantly being a field that women make up. Agree or disagree? The diversity of physicians reflects their patient demographics. The diversity of physicians reflects their patient demographics. So the correct answer here is disagree. And so the AAMC often does a study where they look into the diversity of physicians. And in the most recent study, we saw that amongst physicians, those who identified as white, as Asian, or male were overrepresented. So remember, that term is in comparison to what population statistics would suggest. And those identified as Hispanic, Black or African American or female were underrepresented. So we're starting to see how a field that starts out as very diverse, as we start to dig in deeper, we start to see some of that diversity shifting in ways that is not representative of the patients that we serve. And true or false? Male executives report the same satisfaction as women on various job-related measures. True or false? The answer to this question is actually false. The American College of Healthcare Executives, which is our premier professional association for leaders in the healthcare space, conducts a satisfaction survey annually. And in their 2020 survey, they found that male executives reported significantly higher satisfaction than female executives, and also found that female executives were much more likely to be considering leaving their current organization and even leaving healthcare altogether because of a number of issues, many of which dealt with equity in pay, opportunities for its advancement, and general support of their effectiveness and success. And then finally, agree or disagree? Minority executives are well represented today in healthcare management teams. So again, remembering our working definitions. So in terms of being able to compare the actual number to what population statistics would suggest. And so the correct answer here is actually disagree. Whitkeefer often does a study of senior executives, and as they did this study in 2015, they actually found that even though the actual numbers do not match what population statistics would suggest, the perception of that representation was different based on identity of their respondents. So Caucasian participants actually believed more than other groups that minority executives were well represented. So that is also kind of an interesting disparity there. So here's just a look at some of what is happening in healthcare. So as we started to dig in a little bit as to where we may be not truly leveraging our diversity. You see it even more when you start to think about advancement in our healthcare organizations. Many of you may be familiar with McKinsey and the studies that they are often doing in the healthcare space of diversity, equity, and inclusion progress. And so this chart here just shows, where we start in terms of representation by level of employees kind of in the organization. And so as you can see, as you move through from entry level to the C-suite, you see the representation based on, racial and ethnic background. You see that representation begin to shift and change. So interestingly, as you move from entry level to C-suite, the representation actually becomes less and less diverse. And this is even more pronounced as you look at, what happens for women of color moving from entry level to the C-suite, where you see them becoming less represented. And on the other side, you see, white men becoming more represented. So overall, women are becoming less represented, most significantly for women of color, and white men are becoming more represented. Interestingly, men of color are pretty stable as they move through different levels of leadership in the organization. So some of the reasons that we think this is being perpetuated over time in our healthcare space, even though I think many of us have embraced, as I shared, the aspiration and the vision that we have articulated at BJC to be able to drive equity. Many of us are still really finding challenges in being able to do that. And a lot of that is due to bias. Would highly recommend reading this book if you have not already, by Banaji and Greenwald, Blind Spot, The Hidden Biases of Good People. Fantastic book that really helps understand, how bias works and how it impacts our decisions, but also gives some interesting suggestions and tools, including the implicit association test, to help us identify our biases and then be able to manage them. Because really, we all have biases, right? That is just how we are wired. It's just a predisposition as to how we see events or people, how we make decisions, based on our attitudes and beliefs. But what's most important is that many of our biases are implicit, right? They're kind of operating outside of our awareness and consciousness, so it makes it difficult for us to manage them. And so that's why the implicit association test is a really powerful tool, because it brings those unconscious biases into our awareness so that we can do something to try to mitigate them where we see those biases potentially causing us to make decisions that might not be helpful. So I'll give you a great example. I tend to be a very kind of outgoing, outspoken person, and in a meeting setting, can take in new information, process it, and kind of come to, some determination about a direction or a decision, really in the course of that conversation. Well, others of my colleagues may not, right? Think that way or have kind of other cognitive approaches where they need information in advance to process things. And so I had a team member some time back who I noticed really didn't participate very much in our discussions. And I, wanting to be inclusive, really just checked in with him after discussion and asked, hey, I'm noticing that, you're not really participating in these conversations. And I think you have some great perspective, and I think we could really benefit from what your thoughts are and your insights and your experiences. And he basically shared with me that he needs time to process. He needs time to digest information and doesn't really feel prepared, during the conversation, if something has just been presented during that meeting, to provide any meaningful insight or input. So we agreed that going forward, if I knew we were going to be talking about a particular topic, that I could send him that information in advance, right? Really prepare him to be able to look through whatever, background materials and content, so that he could come to the meeting feeling much more prepared to participate and share. And it just made a world of difference. He actually became one of my really key go-to leaders, someone that I could always rely on, and just had amazing perspective, was very creative, very innovative in his thinking. And I would have missed out on all that, right, if I continued to operate with this bias of, okay, right, I'm just going to throw out the information to everyone in the meeting and expect us to come up with a great decision right now. So it is something that we all, right, are dealing with, are wired to have these biases, but it is incumbent upon us to understand what our biases are and then come up with ways to manage them going forward. I'm also working with several of my colleagues around the country on a tool, a framework that we call the bias timeout. We're really excited about really being able to apply the training that many organizations are offering in the space of unconscious bias to really create a tool that allows people to now apply that training and be able to improve their decision-making, their processes, their policies, by being able to mitigate and even remove bias altogether. So looking forward to, if I have a future opportunity to speak with you all, to share more about that tool. And then, of course, there are many, many types of unconscious bias. And so I won't go through all of these in the interest of time, but again, would encourage you, if you've not tried the implicit association test, to please, take a look at it. And many of these biases, have been reinforced in the literature. One, I'll call out here, name bias. There's been lots of literature that has shown that a resume can be exactly the same in terms of content, but if the name of the candidate suggests that the candidate is, from a racial or ethnic minority, or maybe, born in another country, that often that candidate, again, even with all of the other content being the same on the resume, that candidate is not equally considered for a role, as if when that candidate on the resume's name seems to be a part of a majority group, or be born within this country. So interesting what sometimes bias can cause us to do, and then imagine, right, the talent that we're keeping ourselves from being able to leverage when we make those kinds of decisions. So why is it so important for us to practice inclusive leadership? So McKinsey has been doing a study on how inclusion matters. They've been tracking a number of companies in various industries over a 10-year period, and found that for those firms who are leading in gender diversity or leading in ethnic diversity, or both, they are outperforming on all financial metrics other firms in their industries. And so you see here, pretty significant difference in terms of where these firms are falling. So if you look to the left of the graph, under the gender diversity section, you're seeing that for firms who are performing in the bottom quartile in terms of gender diversity in their leadership and executive leadership ranks, their likelihood of financial outperformance is at 44%, whereas for firms who are very diverse in terms of gender in their leadership and executive leadership ranks, they are 55% likely to financially outperform the other firms in their industry. And similar results for ethnic diversity, with 43% likelihood of financial outperformance for those in the bottom quartile for ethnic diversity, 59% likelihood for those who are ethnically diverse in their leadership and executive leadership. And so this is important. This is an all industry look, but this is critically important for all of us in healthcare now. We're basically our financial outlook for 2023, likely 2024, potentially 2025, is that we will be at best, right, driving 1% to 2% margins. And we know that really is not going to be enough for us to continue to make the investments that we need to support our talent, to continue to, deliver state-of-the-art care, to, invest in our facilities and in state-of-the-art equipment, et cetera, support, all of the services and programs that our communities need us to be able to offer. So as we think about why we might want to pursue inclusive leadership, this is definitely a compelling case. And so that really looked at diversity. One of the challenges that we have, though, is that diversity does not equal inclusion, right? Just because you have a highly diverse team does not mean that you have taken the steps necessary to include the folks on that team, to make sure that you're actually pulling in their perspectives, their insight, their input, that you're thinking creatively around how to have your teams work together, across specialty, across discipline, across spans of responsibility to really solve problems and to be able to differentiate yourselves in the market. And so this graph really just demonstrates that while the same companies in general were seeing, great gains on the diversity front, they still have quite a ways to go in terms of being able to drive further inclusion. And so we'll talk a little bit later about some of the tactics that are going to be important to the inclusive leader to be able to make sure that these things are happening together and with intention. And then I do see a question in the chat, so I'm going to go ahead and address that before I go to the next slide. From Madison Snow, are there common practices or policies in place in healthcare organizations to mitigate unconscious and conscious bias? So there are, I would not say common practices. I think there are many organizations that are working to establish those common practices. And so as I mentioned, I'm actually at a conference of the Equity Collaborative today and tomorrow. And so that's a group of academic health systems, institutions of learning, specifically medical schools, and other healthcare partners and organizations that support us like Vizient and Kiefer and Press Ganey, all with the intent of being able to develop these common practices and policies that we can first demonstrate, right, the impact and the performance for our organizations, and then be able to translate those practices more broadly in the healthcare space. And, I think part of the reason why we haven't really seen established common practices and policies is, quite honestly, for healthcare, this is a relatively new conversation that we're having. And one of the premises that my colleagues and I make in our scholarly work around the bias timeout is that we have the opportunity to really leverage some of the significant progress that we've made as part of the quality and safety movement. We have the ability to leverage some of those learnings, some of those models, some of the culture that we've been able to create and really reinforce in that space to leverage that and bring that into the diversity, equity, inclusion, and belonging space. So we're not feeling as though we're reinventing the wheel, but we're really just expanding some of that work to be able to make sustainable gains in this space. And it will be absolutely necessary. I think what we're learning is, number one, our outcomes, right, rely on it. Our ability to continue to drive consistently high quality outcomes for our communities, regardless of who they are and where they come from, is critical. But also our workforce is demanding our ability to be able to do this in a much more consistent way going forward. So very excited about this work, but lots of work to be done. So grateful for all of you who will be helping us to get there. Okay, so I'm going to maybe power through some of this, but going back to that same diversity wins research that McKinsey has been doing. These are just some of the organizations that McKinsey has been looking at and kind of tracking over time. to see, who is leading in this space and what are some of the things that they're doing. So when you have the opportunity, I would highly, highly encourage you to check out some of these companies. Citigroup, is one that's likely very familiar to all of us. And so Citigroup actually does one of their global financial services firm. They do targeted recruitment. So actually when they see that they have a kind of lack of representation at any level in the organization, they begin to put together recruitment slates that are going to allow them to get better representation. So they are very focused on that, very targeted in doing that. And of course, they're very clear on the capabilities that they are recruiting for, but also making sure that folks are representative of their customer base. They have done quite a bit in terms of focused development and retention efforts, especially for people of color and people who are working, in a country that is not native to them. They have been very intentional and specific about promotion paths and processes. This is one of the spaces that I think is going to be important in the healthcare space. So going back to that kind of common practices and policies to help us drive inclusive leadership, we will have to become much more clear on what the pathways are for promotion and what are the processes by which people gain the experience, the exposure, the training necessary to continue to advance and grow in the organization and continue to effectively drive value for the organization. Citigroup has made the implicit association test mandatory for their team members, and then they actually utilize the learnings at the leadership level to help leaders be able to actually put action plans together on how they're going to manage their biases as they're involved in decision-making, et cetera. And then they have a very strong affinity group infrastructure that really seeks to have folks learn and grow together and understand, different cultural aspects and just experiences of different people all around the world. So a great template for many of us. And I know that many organizations are doing some of these things, but important to note just the intentionality behind it, and also, taking the optionality out of much of it as well. So I won't talk about Pentair, but they're another example in the utilities arena. Target, I'm sure, is another familiar firm to you all in the retail space. Definitely, I think, gained a lot of notoriety, especially as we started to see much of the work that was taking place surrounding the George Floyd killing, and then Lockheed Martin in the security and aerospace industry. So these are firms that really have been leading for a long time and continue to financially outperform, continually, even with all the challenge that's happening kind of in the markets, et cetera, you continue to see them really growing and sustaining stock prices in comparison to other firms in their industries. So if we think about, the imperative really in healthcare, I just want to pose some questions for us to take a moment to think about. And if, we think about like our high reliability journey and the work that we've done in the quality safety space, a lot of that really stemmed from our willingness to ask a question and do some visioning around, what would be possible if we did things differently, right? If we took a different approach, if we had greater commitment, and if we really brought a much more multidisciplinary group right around the table to discuss our opportunities and our options. And so I think the same has to happen in the diversity, equity, and inclusion space. And so when we talk about being an inclusive leader, if we were to apply some of the approaches that, for example, a Citigroup or a Target or others are applying, and we were to do it consistently, right? What could become possible for us what would things look like differently for our teams, for our organization, for the communities that we served if we really had a true commitment in this space of inclusion. We think about all of the challenges that we're facing. We think about how dynamic our environment is and continues to become. We think about how, sometimes overwhelming even it seems, things that we're trying to accomplish and navigate through on a day-to-day basis. And I would offer that, much of the challenge often is coming from the attempt for us to solve for these problems using the same perspectives and the same people that we always have. And so in order for us to be able to move forward, in order for us to be able to thrive, in order for us to be able to really shape our future and not just, our future happened to us, I think that we really need to, in the healthcare space, think differently and be inclusive around how we're moving forward, making decisions, and determining how we're going to continue to serve and care for the communities that we are privileged to do so. And then we can also be making a difference, right, in the lives of the communities that we serve as well, and engaging our communities as partners in helping us to transform, recognizing that our communities bring great strength, bring great expertise, bring great value and resources that really can help us to be better organizations. So one of the reasons why inclusion is such a big deal for me, I really have seen it, tremendously just change not only my leadership, but what happens in my organization and how we come together to be able to really drive change. So Deloitte has been really at the forefront of studying and learning more about leadership and what it takes to become an inclusive leader and what some of the impacts are in organizations where leaders are committed to being inclusive and committed to developing other leaders to be inclusive. And so one of the key pieces of what they found in terms of the activation that takes place in an inclusive environment and culture is, really that commitment to fairness and respect, seeing that leaders are really making a concerted effort to treat people, to treat groups fairly. So again, being able to remove that bias from decisions, being consistent in process, consistent in applying approach, and making sure that folks are clear, right, on what they can expect and what kind of treatment they can look forward to, because it's not arbitrary, right? It's the same across all groups. The other piece that they've identified that really is elevated in this space is that feeling of value and belonging. And I think we're talking much more about belonging these days than we have in the past, and I think that's because people have so many other options today, and so many other priorities, right? Work is one of many priorities, often is not the most important priority. So as people are thinking about how they want to commit their discretionary time in the space of work, they have to feel as though they're valued. They have to feel as though they belong. If not, they will find, right, another environment, another organization where that is possible, and or they'll create their own space, right? There's plenty of opportunity for folks to be able to, in today's economy, create their own space to be able to find meaningful work and create meaningful work. So this is really an important piece of ensuring that your inclusion efforts are actually successful, is when individuals and teams recognize and are recognized and know, that they are driving value, that they are valued, and that they belong, that they are, a critical piece of the success of the whole. And then the other piece that has been really interesting, and I think also is relatively new in just the healthcare leadership space is this idea of inspiration. And so, being able to truly drive creativity and drive innovation through inspiration. And again, I truly have seen and experienced that happening through inclusion, because, as you bring different perspectives and folks with different backgrounds together and people recognize that all of their input is valued, you begin to see people wanting to contribute, wanting to participate in a completely different way, but also the new ideas that now get surfaced literally are inspiring different ideas and different ways of thinking that allow people to be able to navigate new challenges and be even more successful than they've been in the past. So here's, I think, the opportunity for all of us to really just take action as we think about, what it will take for us to be inclusive, for our organizations to thrive. It does really require each one of us to take some stock. Being a leader also requires self-reflection, taking the time to be aware, of your own opportunities and the things that you could be doing differently, the things that you could change in order to be more effective and to support others, right? To be more effective. So I encourage us all to think about, again, whether it's by taking the implicit association test or in other ways, understanding, well, where could I be more inclusive? Where are the opportunities for me to bring more people in, bring more ideas in, bring more perspectives in, so that we're coming up with better solutions going forward, that we've got a lot more energy and motivation behind the work that we're doing, that people feel supported, that we're balancing, right, the workload much more equitably, and people feel a part of something significant and meaningful, right? And that they want to continue to contribute to that. And I think as we think about some of the opportunities that are in front of us, we will not be able to be successful if we're continuing to limit our thinking, if we're continuing to limit the involvement of others, if we're continuing to limit ourselves even, right, to the solution sets that we've kind of become accustomed to and comfortable with. So along those same lines of the work that Deloitte has done, as you're thinking about where there might be areas for opportunity for you to really lean into more inclusive leadership, I would encourage you to get familiar with these traits of inclusive leadership that Deloitte has been offering, and also to think about, are there people that you trust, that you can even engage as accountability partners? One of the things that I've learned in my own leadership, whenever I want to make a change, it's very important that I'm partnering with someone else who I can trust to keep me honest, right? About, have I actually made a change and made a difference, or am I continuing to do what I've always done? But also, to help me continue to make progress when I might be running into, roadblocks and barriers. So here are some of the traits of inclusive leadership that are really critical in being able to create a sustained, inclusive environment where folks do feel like they belong, they do feel valued, they do feel as though they contribute. First of all, definitely is that commitment. And especially nowadays, people can see your commitment, right? Commitment is not just about verbalizing your commitment. Commitment is about demonstrating your commitment. So through your personal values and your willingness to continue to pull people back to not only the right reasons, but also the business reasons for inclusivity in our organizations. Courage is always, an important trait for any leader. And again, especially today, and especially in this space, right? This is a relatively, as I mentioned earlier, relatively new conversation for us in healthcare. And so it does require many of us to have the courage to keep that conversation going, to not shy away from it, to be able to absolutely celebrate the gains that we're making in the space, but also call out when we're not advancing as much as we need to in the space. That cognizance of bias, so again, that willingness to do the work of raising your own awareness about your own biases, but also recognizing that, especially for those of us who are in leadership roles, those of us who are aspiring to leadership roles, our biases in some way, shape, fashion, or form often become our team's biases, often become our organization's biases, right? Our biases kind of get reproduced, and in some cases even, become institutionalized. So it's very important that we understand what our biases are, that we are putting into practice actions to mitigate those biases, and then we are doing the work of understanding, okay, how much further out do I need to make some changes to ensure that bias is not negatively impacting decisions, outcomes, policies, processes, et cetera. That curiosity is really important, right? We all aspire to and subscribe to a commitment to lifelong learning. And so curiosity is part of that, right? Being willing to understand others, other perspectives, other experiences, valuing those, creating space for those to be considered and integrated into our decisions. That cultural intelligence. So again, after learning about where people are, what's important to them, how are you then taking that into consideration in your interactions, and making sure that you are willing to make that change. So again, going back to that story that I shared about the person on my team who needed time to process, right? It's one thing to have asked the question and showed my curiosity, but it was a whole nother thing to say, okay, now I'm going to make some changes in the way that I lead to really make sure that this person can be fully engaged going forward. And then of course, the collaboration, right? So always looking to amplify voices, always looking to bring people in. One of the maybe silver linings of the pandemic and our enhanced use of technology is now we don't have to worry about, does the room have enough seats for all the people I want to invite, right? If you want to expand the circle, if you want to expand whoever the stakeholders are, it's much easier to do that now. You're not searching across the organization for a room big enough to house everybody. You can just get us all on a virtual meeting and or create additional kind of spaces to pull that input in much more easily. So really important that we're doing that. So I just want to thank you all and open up now for any questions that folks may have in our remaining time together.
Yeah, thanks, Gina. So again, we have another 5 or 6 minutes, and I don't know if people want to add it to the chat. Certainly, you can add, and then I can either read them to Gina or she can read. But it was really a great talk, and maybe I'll just start off with one to sort of get us started. So you told us about some challenges, but can you tell us about another challenging situation where you experienced as a leader in rallying employees and leaders in your organization to support DEI? What was a challenging situation you experienced to really encourage people in your organization to support DEI?
Yeah, absolutely. Dr. Butler, I have unfortunately no limit to a number of situations and stories like that. I'll share one from very early in my career because it I think challenged me also because of where I sat in the organization. We had a situation where a very small team of folks within the organization wanted to do something impactful, positively impactful in the space of diversity, equity, and inclusion. It was very early in our organization's DEI journey, and they decided to put together a cultural competency booklet. These folks were kind of closer to the action in terms of patient care. And so as you can imagine, very busy, lots of kind of operational issues to deal with every day. And so the group just got smaller and smaller and smaller until it got to only one person who ultimately was the person who put together the booklet without having a lot of input and vetting from others in the organization. So the booklet gets published, and it unfortunately did the opposite of raising our kind of standards and capabilities in terms of cultural competency, and unfortunately was full of all kinds of discriminatory, stereotypical, prejudicial information, and set the organization aflame. So at the time, I had just been promoted to my first director role, and was at a loss as to what I should do. You know, on the one hand, I was kind of like, okay, maybe I should pack my bags and leave, because if this is what the organization thinks about me, I don't need to be here. But on the other hand, I said, well, you know, I'm a leader. And the fact that this booklet has the organization's name on it kind of has my name on it. So I need to do something. I'm not entirely sure what, but I need to do something. And so I talked to, you know, my leader at the time. There were, you know, a group of folks in the organization who, you know, basically were ready to bring it to its knees, and asked if we could get an audience with our president and CEO. And we were able to do that. And, you know, fast forward, began a healing journey for the entire organization, a healing journey for the community. One of the things that, you know, I had the you know, blessing of offering was a lot of my community connections and networks to the process, to be able to, you know, have them be a help and be partners to us in the work that needed to be done to kind of undo some of the trauma that the experience had caused us, and have us grow out of it, and have us, you know, really commit to DE&I going forward. And I will say, it was probably one of the hardest experiences I'd ever had. I remember, you know, lots of nights of crying and being unsure, you know, of myself and of, you know, what my role should be, and whether I should even stick it out, or, you know, any of those things. But what it taught me was that it was important to extend grace to everyone involved. We, you know, learned kind of the details of how the booklet came to be, and I think our organization responded in the right way to the entire team, to the community, and then handled appropriately the you know, kind of author of the booklet as well. And it, I think, also helped me from a leadership perspective, you know, really understand what was at stake when those types of situations play out, but also how critical it is that leaders stand up and step forward, no matter, you know, where they are in the organization, no matter what their role is, to help the organization to be stronger and better coming out of it. So I would encourage anyone who, you know, finds yourself in a space where you're kind of like, oh, I'm too junior, or, oh, you know, I don't think I have enough influence, or, you know, I don't have the positional authority, or you'd be surprised at what impact you can have, and how critical it will be, right, that you take that opportunity to have that impact. Your organization, your community will be the better for it.
No, that is a great example, and checks off a number of those characteristics: bravery, courage, accountability, all those things. We have a couple more minutes. Does anyone either in the chat or just unmute yourself and ask Gina a question? Maybe another couple of minutes.
I have one question here, Dr. Butler, I think I'm seeing from Jessica Denton. She says, I'm wondering if you could share your thoughts on how to reach the reluctant members of an organization, those who are not interested in learning more about DEI, but who are probably the ones who need it the most. I think that's a fantastic question, and is the case really for any, right, initiative or any change management opportunity that we find ourselves embarking on. And so one of the things I think is critically important is to understand who those reluctant members are, and actually go and talk with them directly. Have those conversations with folks one-on-one. This is the group who really can make or break any change management initiative. And for DE&I, this is a journey, right? This is not even an episodic type of thing that we're working through, but this is us improving and changing and enhancing who we are and what we're about every single day. So you have to be willing to sit down and have the conversation, understanding who might be the best folks in the organization to have those conversations, really listening and hearing, right? Where is the hesitancy? Where is kind of that reluctance coming from? And being willing to work with folks to help them progress. You know, if we think about some of the work that we had to do in the space of COVID vaccination, right? Many of us had to do exactly this. And it takes literally kind of the one-on-one, one-by-one approach. And you won't have everybody on board. And so understanding that is important, but it gives you some important insight as to how to continue to move people on the journey. And then, you know, as you identify people who really are detractors, not just reluctant, but, you know, potentially are intentionally setting up barriers, it's important to know that as well, because, you know, you may need to make some other decisions about folks who are intentionally trying to block progress.
Well, again, thank you for that wonderful, wonderful insight. Gina, I want to thank you for taking the time, especially while being away at a conference, to share your time with us and your experiences and your knowledge. Also important, I want to put a plug in for the book Blind Spot. If my video is on, I have Blind Spot on my desk. I refer to it often. It's a very informative book, only a couple of 100 pages, and it really is informative about you know, about hidden biases we may have. I also want to thank the UAB Diversity, Equity, and Inclusion for the Community Month initiative and our school's DEI committee led by Jessica Williams for placing a focus on this initiative every month. I want to thank Amanda Sherman, Mary Foster, Sherry Hamilton for all of their help in making this happen. And finally, a special thanks to each one of you. There were almost 100 people attending today, but especially everyone in the school for their commitment to diversity, equity, and inclusion. And like me, I know DEI is on your mind all year long. And everyone, I want you to have a wonderful afternoon and take care of yourself. Thanks, Gina.
Thank you so much. Have a great afternoon, everyone.